I am delighted to welcome you to these new international awards for medical writing in social media. It is wonderful to have such an international audience from Canada, United States, throughout the UK, from Germany, the Netherlands, and Spain, and from Nigeria, India, Hong Kong, and Australia. There are 3 partners involved in these awards: Medical Society, the Fellowship of Postgraduate Medicine, and its 2 international journals, the Postgraduate Medical Journal and Health Policy and Technology. As background, the FPM was founded by Sir William Osler just over 100 years ago. Osler saw medical societies as very important for providing rational, continuous medical education for doctors and other health professionals. The FPM is continuing his legacy by holding conferences, through its journals, and in COVID times through a regular webinar series aiming to provide updates on clinical practice as well as advances in medical science. Trusted medical writing is much needed in these times of fake news and half-truths. I'm delighted that we've had such an outstanding international field of entrants for these awards. We shall hear from our international panel of judges. We shall hear brief talks by our shortlisted entrants, and then the results of the awards. I shall now hand you over to 2 members of our Postgraduate Medical Journal senior team, our Editor-in-Chief, Professor Bernard Cheung, who's joining us from Hong Kong, and our publisher, Henry Spilberg from BMJ Publications, who is joining us from London.
Well, welcome everyone. Good afternoon to people in the UK and Europe, and good morning to people from the US and from in Americas, and a good evening to people from Asia. I'm Bernard Cheung. I'm the Editor-in-Chief of Postgraduate Medical Journal. I was privileged to be on the panel of judges for this FPM International Award for medical writing. It really was a pleasure reading all the entries, and really, you know, in my view, all the shortlisted writers deserved recognition, if not a prize. We know that nowadays the internet has really a global reach to every corner of the earth, and to countries in which English is not the first language. But through the vast power of social media, everyone in the world, even in the remotest corners of the earth, would be able to access the internet, and English is really the lingua franca, the common language on the internet. And a lot of people learn English this way. It's both good or bad, because because of necessity, a lot of the messages are very brief and perhaps even ungrammatical. But nevertheless, it's a kind of new language. So I think it was with a lot of foresight that FPM initiated these awards for medical writing, and for particularly for trusted medical writing, because unlike articles published in journals which undergo peer review, a lot of things published on that appear on social media have not been edited or peer reviewed. So I think that gives the writer a lot of power and influence, but at the same time a lot of responsibility. So I think it is really with a lot of with much pleasure that that I look forward to the announcement of the winners of this award. And may I offer in advance my congratulations to the winners tonight. Over to you, Henry.
Thank you very much, Bernard, and hello good afternoon, or good morning, or good evening to everybody joining the meeting today. It's wonderful to see so many people here. As Donald said, access to trusted information is always important, and never more so than in this year of the COVID-19 pandemic. So the creation by the FPM of the International Award in Medical Writing for Social Media could not be more timely. And as the publisher at BMJ for the Postgraduate Medical Journal, I've been privileged to support the awards, delighted to be involved, and I've really enjoyed reading all of the entries as part of the judging, as Bernard has touched on. So we know that patients, their families, and the wider public have access to an almost limitless source of information online about all aspects of medicine and healthcare. And that's made instantly available through the World Wide Web and social media platforms. But unfortunately, of course, the volume of misinformation and even disinformation can make it hard to distinguish what is trustworthy from advice or opinion that maybe should be regarded as false, inaccurate, or worse still, dangerous. And the bizarre recommendation from a certain world leader a few months ago that injecting bleach could protect against coronavirus is just one example that comes to mind. But the good news is that doctors as a profession continue to be among the most trusted, one of the most trusted groups in the eyes of the public. And in fact, even as recently as last month, the polling organization Ipsos Mori carried out a survey in the UK, the Veracity Index, asking people to rate the professions that they thought were most trusted. Nurses scored the highest, with 93% of those surveyed trusting them to tell the truth, and doctors came in a very close second with a 91% trustworthiness rating. So I think this makes it more crucial than ever that the voices of medical professionals, medical and healthcare professionals from around the world are heard. And whether that's in the form of a preprint, a peer-reviewed research paper, a blog post, or a magazine article, the dissemination of that trusted information is really, really important. And that's where these awards come in. So I'm delighted, therefore, to announce the 3 commended entries from among those submitted. And these are, firstly, the fascinating story of the connection between hydroxychloroquine, British India, Srirangapatna, and gin and tonic. And that's by Kaushik Bhattacharya, who's a specialist in surgery at CAPFS Composite Hospital Border Security Force, Kadamtala in India. Second, Doctor Suicide, How Many More, by Giles Dornay, who's a general practitioner specialist trainee based in Hereford, UK. Third, Patient Involvement in Child Healthcare by Lena de Mazière, who's a physician in pediatric training in the Public Health Department in Schwäbisch Germany. And links to all 3 of these entries will be posted on the FPM Awards website.
Thank you, Henry, and congratulations to all the commended entrants. We shall now hear all 6 entries which were shortlisted for the International Prize. And these are from Canada, USA, England, Scotland, and India. To begin, we shall hear from Conor Brenna, who is an MD candidate at the University of Toronto. Conor will now discuss individual responsibility and triage priority.
Good morning from Canada. Thank you very much for having me. It's an honor to be invited here by the Fellowship of Postgraduate Medicine, and it seems only fitting that despite the ongoing pandemic, we found a way to connect with each other all across the globe to celebrate scientific communication. My name is Conor Brenna. I'm a graduate of the University of Saskatchewan, and I'm a medical student graduating this spring from the University of Toronto, which is here behind me. And my submission is titled Ethical Principles and Individual Responsibility in Triage Priority. To provide some context, it was originally prepared about 4 months ago for a public-facing online forum called Cafe Bioethics, which is maintained through the hard work of a group of Canadian students that are interested in making modern philosophical discussion more accessible to the public. And that interest is one that I share. It's one that I think is increasingly important in an era where the divide between academia and broader society certainly feels like it's getting larger, particularly during COVID-19, which has presented so many novel challenges for all of us. In my own community, and perhaps in yours as well, I've seen a number of protests against things like lockdown measures and mandates to wear masks in public places. Only 3 weeks ago, in a small town called Aylmer in the province of Ontario, where I am, just after that community had declared a state of emergency, 2,000 people marched with signs that read things like, "I would rather die of COVID than loneliness," or "Lockdowns violate human rights." Now, regardless of your beliefs in the limits or the limitlessness of civic freedoms, it has long been known that choosing to participate in any event in such close quarters with so many people would increase your risk of transmitting a virus that could make you sick, or that you could pass on to someone else. And so it was events like these that prompted Cafe Bioethics to ask local bioethicists to weigh in on the question, should lockdown protesters who subsequently contract COVID-19 receive less priority in the allocation of scarce medical resources? And this is the topic of my article. Put another way, it responds to the question, if two otherwise identical patients contract COVID-19, one while attending a lockdown protest and the other while adhering to lockdown measures, were to arrive in an emergency department with one ventilator, who should receive it? It's a difficult question. And to answer this, my work describes the process of triage, which is the model on which medical care is allocated when there aren't enough resources for everyone. It also outlines the typical considerations that are inherent in those decisions, things like distributive justice, and then several unique conceptions of justice, things like retributive or corrective justice, that have only recently entered the medical ethics sphere in the context of events where patients might be thought to bear some degree of responsibility for their own or for another patient's condition. And ultimately, while I offer some thoughts about what degree of responsibility a person who contracts coronavirus at a protest against public safety measures might be thought to bear, I argue that the appropriate setting for assigning blame is not the emergency department, and that the physician's role is that of a healer, not as an agent of this retributive or corrective justice. The legal system will be responsible for delivering judgment on the actions of those who might endanger others, but our training, at least mine, is to treat the sick. So there are a number of more or less legitimate ways to allocate a limited resource, especially in the context of a pandemic, but I don't think that individual responsibility for illness should be among them. If you have a chance to read the full piece on their website, which is cafebioethics.com, I would love to hear from you. Otherwise, thank you again for having me here, and congratulations to all of the other entrants on their excellent submissions.
So thank you very much, Connor, for that excellent presentation. The next in our list, on the shortlist, is Emma Connor, who's a director and child psychotherapist at Eurospace Therapies, and she's based in England at Burgess Hill. And her topic is supporting schools after lockdown.
Hello, my name is Emma Connor, and I've written a blog titled Supporting Schools After Lockdown for PESA UK. The blog is a 7 series, and the aim of the blog is to really make an impact on supporting schools after the nationwide closure of schools due to COVID-19. The focus of the blog is, first of all, on staff mental health and supporting teachers to reintroduce children into school. And then we cover topics such as the impact of loss during COVID-19 and the loss of school relationships, resilience and how to support young children to create resilience, seeing this period as an opportunity for healing and boosting attachment between children and school staff with the ultimate aim of healing trauma. We also think about the huge healing benefits of mutual joy and the chance that we have to start anew and do things differently in our UK curriculum in order to support children who have had adverse childhood experiences, and COVID-19 being an extra experience that they need incredible support with at this time. So the blog references polyvagal theory, attachment theory, John Bowlby and Mary Ainsworth, concepts from Donald Winnicott, and also neuroscience to underpin the strategies that I provide in the blog. And my passion and my main aim in the blog is to really provide school staff and child psychotherapists with practical strategies for supporting children on their return to school after lockdown. These strategies are easy to implement and rooted in cutting-edge neuroscience and theories from child psychotherapy. What I really want to do with this blog is to have this as a contribution to creating therapeutic school communities, and also to help children to love, live and learn to the best of their abilities. Thank you.
Thank you very much, Emma. Next, we have a joint entry from India on social media in the times of COVID-19 from Latika Gupta, who is an assistant professor in Lucknow, and Ashish Goel, who's a professor of medicine in Delhi.
Do scholarly journals feel threatened by social media? Nah. Well, they should.
A very warm good evening to all of you from India. I am Latika, an assistant professor of clinical immunology and rheumatology, working at the Sanjay Gandhi Institute of Postgraduate Medical Sciences. I also happen to be the social media editor for 4 rheumatology journals.
And I'm Dr. Ashish Goel, a professor of medicine at the College of Medical Sciences at the University of Delhi. A very good evening from India.
We conducted a search using the terms COVID-19 and social media, and it revealed nearly 1,000 articles on PubMed alone. When we had conducted the search in June this year, there were only 100 articles. So there's a 10-fold increase in the volume of articles on this subject. What we are seeing is nothing short of an infodemic. And in the past few months, learning and academics has largely moved online. Scholarly journals have also embraced the idea of an online presence. It seems that social media is here to stay. So today we will define and try to redefine the role of social media in academia, find the intersection of between social media platforms and academic literature, and try to get a sneak peek into the possible future of scholarly journals and the role of social media in shaping the future.
Well, while working on our paper, we tried to find the key contributions of social media in the scientific literature world, and we realized that dissemination of knowledge is one important role that social media has played. In this aspect, we realized that the guidelines which have come up for COVID-19 have had a very short shelf life, a very short half-life, and social media platforms were easily able to keep track and keep pace with the changes in the guidelines and were more popular. This may not have been possible with the academic journals and the hardcore scholarly publications, which take a long turnaround time for articles, and dissemination was much easier on the social media platforms.
So virtual consulting is another important use that social media platforms are being used for, and it allows the healthcare provider and seeker to be separated in time and space. In fact, even the most ardent critics of teleconsultation have found opinion online during the pandemic, and hospitals have transformed overnight, even in the developing countries. Image transfers were never as easy as they are in this period.
So we also realized that social media platforms played an important role in education. Things like wearing masks or following hand hygiene were circulated through social media platforms, and the community at large learned these skills from here. And not only about the community, but even harder skills like taking swabs or donning and doffing of personal protective equipment was shared by hospitals, administrations, and different agencies through social media platforms. And many healthcare providers picked up these skills on these platforms. In fact, also, research was so much more easier on social media platforms. Gathering data was easy. Survey tools had a wider reach. The artificial intelligence mediated data mining tools, assessment, analysis, and interpretation became much more simpler and widely accepted during these times.
Despite the distinctive advantages of a wider reach, very high speed of communication, brevity, and most importantly, instant gratification, unfortunately, social media is also marred by various pitfalls, which include poor accuracy. In fact, there have been instances of misinformation that have led to much damage. There is no peer review, which may result in misinterpretation. There is poor accountability, and occasional instances of cyberbullying and incivility have been reported. It seems official that social media platforms have taken a sudden plunge into the scientific literature market. Medical journals have come of age and have realized the need to develop individual social media platforms where they're present. However, in the times of this infodemic, it is important that social media editors play the role of warriors, and they may do that better when there's an alliance of social media editors online.
So, when trying to conclude in a nutshell, we would like to say that social media is here to stay, and social media has arrived. In the words of Victor Hugo, nothing is more powerful than an idea whose time has come. But with the advent of social media, there has been an arrival of an infodemic, which has cluttered the horizon and has left everyone confused. At such times, it becomes even more important for the scientific journals, which have been blessed with a unique responsibility and an opportunity to establish their own social media platforms, because they are the new infodemic warriors in a new scientific world. Thank you.
Thank you very much for joining us today. And as I talk to you, this is the view of the campus from my place. Once this pandemic is behind us, you're welcome to come join in Lucknow and enjoy the view for yourself. Thank you.
Thank you. Thank you, and a very good evening.
Latika and Ashish, thank you very much indeed. We now come to our fourth shortlisted entrant, who is Rhian Last, a nurse educator from Leeds in England. Her topic is COVID-19, fake news, and the role of the general practice nurse.
My name is Rhian Last. I have a long experience working as a general practice nurse in a surgery in Leeds here in the north of England. A general practice nurse is a nurse who works in primary care in a general practitioner surgery. I now work in clinical education. The title of the article is COVID-19, Fake News and the Role of the General Practice Nurse. A brief overview. Social media and online sources are rife with misinformation and disinformation, never more so than now. The article explores the issues surrounding fake news and COVID-19, considers them in relation to the role of the general practice nurse, and discusses solutions. There are learning outcomes identified for the reader. After working through the article, the reader will be able to describe the various types of fake news, recognise the imperative for promoting reliable sources of COVID-19 information, and develop a strategy for effective patient communication and information signposting. The key learning points to draw from the article are that while social media and internet resources are proving valuable during the pandemic, they also have the potential to spread fake news. Fake news can be categorised as misinformation, that is to say inaccuracy and errors, disinformation, that is to say, deliberately created falsehoods, and rumour. False information can cause worry and distress, and in some cases, real physical harm. There is research which has demonstrated that nurses are the most trusted profession. With that in mind, general practice nurses can play a valuable role in countering misconceptions and signposting patients to reliable sources of information. The article was published in Practice Nurse Journal in May 2020, and as we continue our journey with the COVID-19 pandemic, much of the learning points remain highly relevant to the situation right now.
Rian, thank you very much indeed. Our next shortlisted entrant is Madeline Rodriguez, who is a trainee physician at Johns Hopkins Medical School in Baltimore in the USA, and title of her entry is Flattening the Curve.
Hello, my name is Madeline Rodriguez, and I'm one of the current third-year internal medicine residents at the Johns Hopkins Bayview program in Baltimore, Maryland. This past spring, I had the opportunity to write and share my thoughts on the innovations happening around medical education because of the COVID-19 pandemic. As more and more patients poured into our hospitals, we required the redeployment of faculty in general internal medicine and geriatrics to work alongside our internal medicine residents in the COVID unit. And many of the faculty found themselves in situations where their expertise in their own fields in outpatient medicine and research, for example, were met, if not exceeded, by the expertise of internal medicine residents in acute inpatient care, in communicating with interdisciplinary staff, and really being clinically excellent providers at the bedside. And so, as someone interested in medical education myself, I really found myself observing a novel phenomenon, the flattening of the traditionally vertical learning curve or hierarchy in medical education that I think we've tolerated for decades. And so I came up with 3 key ways that we could help our faculty become more clinically excellent in the pandemic, although I think they translate beyond that. The first was that I think trainees could model effective communication. I think not only did attendees need to learn the logistics of inpatient medicine and who to communicate with, but could really learn a lot by residents who spend so much time at the bedside coordinating care and role modeling effective communication to the patient, the family, and all of the interdisciplinary staff at the hospital. The second key takeaway was to teach what you know and commit to a growth mindset. I think trainees are so used to feeling like they need to know more and that they don't have expertise. And I think in COVID-19, the entire medical community felt that way to a certain extent as they were learning and sharing evidence in real time through various mediums. And so one of the beautiful things I think that happened with these teams with both faculty and residents was that we were able to say, I don't know, and be curious about the answer and commit to a growth mindset. And I think those are skills that will translate beyond the pandemic. And so I would encourage trainees to really ask your faculty to continue to ask questions and stay curious and grow alongside you. And the last key takeaway to help our faculty become clinically excellent was to really role model humanism and vulnerability during this extremely difficult time. This is a very vulnerable time for everybody across the globe, and it's extremely difficult to feel connected in a virtual world and in a physically distanced world. But I think that residents were very expert in sharing how they were feeling and listening to their faculty and acknowledging that this new normal was abnormal. And really, and most importantly, role modeling the empathy that holds us accountable to ourselves and to each other as we emerge from the COVID era. And so ultimately, I observed people dealing with the pandemic in many ways, and certainly there have been many challenges. But what I would encourage you to do is look at the systems around you such as the traditional hierarchy in medical education, and look for the ways that there are positive changes and think about how you can be intentional about supporting that long-lasting change. For me, that looks like creating a legacy of longitudinal learning relationships, and I hope that this is something we can encourage nationally and globally. Thank you.
Madeline, thank you very much. Our final shortlisted entry is from Charlotte Squires, who's a registrar in geriatric and general internal medicine in Melrose in Scotland. Her title is The View from the Other Side.
Hello everybody, my name is Charlotte Squires and I'm a specialist trainee in geriatric medicine based in South East Scotland, and I'm so delighted to have been shortlisted today. My piece, The View from the Other Side, was written when I suddenly found myself on the wrong side of the stethoscope for the first time, following a diagnosis of advanced lymphoma in 2018. As a trainee in a specialty known for challenging conversations, I thought I knew a lot about communication skills. As a patient, however, I realised that actually, like many healthcare professionals, I actually had substantial blind spots. We often focus so hard on teaching and learning particular aspects of communication, such as how to break bad news sensitively or how to communicate clearly during an emergency, that we completely forget that there is also an impact from the frequent and perhaps less dramatic exchanges that form a large part of every patient's day-to-day experience. During my treatment, some of the most stressful things fell into this category. Trying to get to a crucial scan on time only to find that the directions I'd been given left me going round in circles made me anxious, as did waiting for a phone call from my team that was forgotten about, or spending an afternoon chasing up prescriptions that arrived with mistakes or perhaps without signatures. There are so many other examples of things not quite going to plan, and all of it seemed to be to do with communication. There's an administrative load to being a patient that I didn't really appreciate as a doctor. And unlike as a doctor, it doesn't stop when you leave the hospital building. And much of it entails chasing up plans and prescriptions and what to do in terms of your treatment. And so much of this is complicated when communication isn't clear. Many of these mishaps were simple clerical or human errors, but the impact of them for me was cumulative, and at times it felt more surprising when things went to plan than when they didn't. I started speaking to other people with significant health problems, including cancer, and I found that most of them had similar stories to me. And interestingly, they were stories that rarely seemed to filter back to their doctors. How can we actually work to improve a system if we don't really know that it's broken? Another issue is that clinical staff are always a little bit on show, and we don't always realise the impact of our words. I overheard many things from my chair in the chemotherapy unit, where I spent a lot of time, and not all of them painted staff in particularly good light or made me feel particularly safe. Imagine for a second that you're hooked up to a potent chemotherapy infusion, that you feel incredibly nauseated within seconds of it entering your bloodstream, as per, and then you overhear a discussion that there was maybe a mistake with how it was prepared. You'd probably feel a little bit unsettled. Perhaps you've come in for a blood transfusion on a Saturday and you hear someone moan that it's a pain for them to organise, not realising that it's probably not as much of a pain as being severely anaemic. An unthinking comment from us as healthcare workers can have a lasting consequence on the trust our patients have in us. As a doctor myself, I know that I've made so many similar slips and mistakes during my own practice, and I also know that I probably haven't realised their significance. On reflection, I know that many of these will have happened when I'm tired and stressed and overworked, and I know that this will be the same for most of us, and was probably the case for the people that looked after me as well. Being a patient is a strange experience. You suddenly become somebody that people do things to and discuss and mull over in ways that you probably don't quite understand. You need to feel that your team are all on the same page when you put yourself into their hands. Can I trust you to look after me when I really need it? Can I trust you to keep me safe? They say it takes a village to raise a child, and I think it also takes one to care for a complex patient. And everything goes much more smoothly when that village feels safe and collaborative and competent and efficient. And so much of that comes down to the way that we communicate. How then do we change this? Part of it might be thinking about how we teach communication skills and what we choose to focus on. Part of it, as healthcare workers, might be being brave enough to ask our patients what they've seen and heard that has impacted their experience and their trust, and having the humility to sit back and listen to what might be an unexpected and challenging answer. And part of it might be reflecting on the impact of our own emotion and energy on our ability to communicate well, and to consider what we need to do to ensure that our own needs are met, so that ultimately we can meet the needs of those that we care for. Thank you very much.
Charlotte, thank you very much indeed. I shall now hand over to the Editor-in-Chief of the Postgraduate Medical Journal, Professor Bernard Cheung, who is joining us from Hong Kong, to announce our international winner.
Thank you very much, Donald. We've heard 6 very good presentations of the shortlisted winners. I think you agree with me that the standard is very high. They are all excellent writers, but at the same time also eloquent speakers, making very engaging presentations. So you can imagine how hard it was for the judges to come up with the list of winners. It is therefore my pleasure to announce the international winner. The winner is amongst us. The winner has joined this Zoom meeting, and the winner is from Baltimore, Johns Hopkins Medical School, Dr. Madeline Rodriguez, and her winning entry was entitled Flattening the Curve. Congratulations, Dr. Rodriguez. Madeline.
Thank you so much. I promise I'm smiling behind the mask. If I could just have a minute, I'm really humbled to be among all of these very excellent writers and all the facets of their care. And I thank you for caring for patients and doing the work that you do in this incredibly difficult time. I'd also like to extend my thanks to FPM and the publication that my piece was initially published in Closler, which is published, I think, by Scott Wright, or edited by Scott Wright, who is one of my research mentors and who's on this call. I think narrative medicine is incredibly important, not only to help stop the misinformation that's currently happening, but it's so important to me and many of the other trainees in processing the difficult elements of our job. So I really applaud everybody in going beyond their traditional clinical roles and advocating for their patients in so many ways. And again, I'm just very humbled and thankful. Thank you so much.
Madeline, many congratulations. We shall now hear about the results for our International Regional Awards, and these will be introduced for us by 2 further judges, members of the editorial team for our other journal, Health Policy and Technology, our Editor-in-Chief, Ken Redekop, who is joining us from Rotterdam in the Netherlands, and our publisher from Elsevier for the journal, Jose Mena, who is joining us from Barcelona in Spain.
The title is as broad as it sounds, basically. It covers anything under the sun as long as it relates to health policy and technology. And typically, it's the combination of the two. But the entries for these medical writing awards represent a different kind of focus, particularly on social media and trusted medical writing, than the large majority of those manuscripts, although the content to some extent might overlap. 2 things I wanted to sort of touch on. One is just something that I sort of heard by chance, is that today's Mark Twain's birthday. Now, he's not alive anymore, of course, but his work lives on. And interestingly, he not only wrote very popular fiction, which is known to this day, of course, but he also had 3 patents to his name. And in addition, he also explored what was termed alternate histories, what could have happened if we had done something different. You can imagine in this time of pandemic, we're all seeing this whole discussion about what could have happened if we had done lockdown earlier, what could happen in the future if we were to have greater access to vaccines and that. Now, these are speculations, but these relate to discussions about how to move forward. What should we be doing in the future to save lives or to improve health? So I think that that's sort of an interesting coincidence, but I don't want to go beyond that thought. I think that a lot of what we call medical writing actually goes far beyond disease and medical treatment, and actually covers many aspects of what we could call health, or perhaps the opposite of health, whatever it is. I would even say that medical writing relates to much more than that, moving along different dimensions and exploring and sharing various issues and feelings from many different angles. So I would therefore sort of say that the term medical writing should be changed to something else. Now, maybe health and welfare writing, but that's not a very catchy term. In fact, it sounds like what a government agency might say that it does. So I don't think we should dwell too long on what the term is, but certainly remind ourselves that it's just a shorthand way to refer to a rich variety of writing styles and forms. Now, on that note, there was so much variation that I think that I can speak for all the judges when I say that we found it difficult to compare different forms of medical writing. And it forced us to consider what good medical writing entails. And while the categories this time were based on geography, I think we could even think about different categories in the future. Something along the lines of the Nobel Prizes or the Oscars or the Grammys. And who knows, in the future, maybe we might see medical writing in the audio category, or medical writing in the video category, or perhaps even medical writing in the virtual reality category. And I think as part of that, the journal that we called Health Policy Technology, it's a matter of understanding where we could be headed. And I think that this definitely relates to social media and where social media is headed, and how we can ensure that better decisions about health policy and health care can be made. And one essential factor is getting the general public on board. And we've got to ensure that they remain thinking about what the actual issues are, understand what the differences between facts and alternative facts, and make sure that they think critically about what they see in social media. On that note, then I would like to leave you with those thoughts and pass the word on to Jose Mena, who's a publisher at Elsevier Press.
Hello, everybody. First of all, I would like to thank Donald for the opportunity he has given me to participate in these awards as a judge. For me, certainly have a special meaning. We are living a very complicated year where trusted and consistent scientific information has reached the highest levels of importance. Today, with the situation we are suffering with COVID-19, accessing verified information acquires much more relevance if possible, if we take into account the amount of hoaxes, rumors, and lies that appear not only on social media, but also in some newspapers and radio and TV programs, right? Many people are sharing unfounded news in their Twitter, Facebook, Instagram, or other social media accounts. And I really reckon that everyone, and not just clinicians or researchers, needs to feel safe with the information they read. And this is where the importance of scientific publication, peer review, scientific endorsement from editorial boards and societies and other scientific institutions lies. I think we all have a big responsibility, and we must make every effort to ensure that everyone can receive trusted and verified scientific information. That is why being here today with all of you is so important for me. And I thank you all for helping to achieve this goal. Thank you very much.
Thank you, Jose. Jose will now announce the first 3 of our international regional awards. Over to you again, Jose.
Links to all entries will be posted on the FPM Awards website. So the first one is the award for Europe, that is for The View from the Other Side by Charlotte Squires, registrar in geriatric and general internal medicine, Melrose, Scotland. Congratulations.
Thank you so much. This is such an honour, actually, and I'm so delighted. And I think, I suppose, although they're not listening, and I'd just like to say a big thank you to my colleagues at the Borders General, who've just been incredibly supportive during my return to clinical practice, and also so supportive of some of the writing that I've been trying to do as well. But thank you so much. It's been so lovely joining this FPM community this afternoon as well.
So the next one is the award for North America, and it is for Flattening the Curve by Madeline Rodriguez from the Johns Hopkins Medical School, Baltimore, in the United States. Congratulations again. So the next one is the award for Africa, and it is for Medical Devices Between Fail-Safe and Safe Life by Abdullah Olaya. He's postgraduate student, biomedical engineering in the University of Ibadan in Nigeria. Congratulations.
Thank you very much. I'm glad to be represented here, and I give kudos to the FPM International Award. Likewise, my colleagues in the University of Ibadan, graduate study biomedical engineering. I would also like to commend my co-workers at the Federal Medical Center of Lakuta. Thank you very much for this award. It means a lot to me, being a graduate entry into biomedical engineering, and I do promise to make the community proud. Regards to AMI too. Thank you very much.
Thank you, congratulations.
Thank you very much, Jose. So thank you for that. We're now going to hand back to Ken Redekop to hear about the final international awards. Back to you, Ken.
Yes, thank you, Donald. I just wanted to say once again, we really enjoyed reading different entries. The award for Asia goes to the person to the social media in the times of COVID-19, Latika Gupta, assistant professor, and Sanjay Gandhi, postgraduate Institute of Medical Sciences, Lucknow, India, and jointly with Ashish Goel, associate professor in medicine, University College of Medical Sciences, Delhi, India. Congratulations.
Thank you so much. I feel truly honored to be part of the FPM community today, and it is absolutely delightful to join all of you. I'd like to especially thank the Journal of Clinical Rheumatology, where my journey as a social media editor began last year in January, when I told them that I'm happy to serve as the social media editor, provided they have no better choice. And it's been a great journey. Now today, I'm the social media editor for 4 different journals, and I feel that I have a greater role and more responsibility in the times of the pandemic. And lastly, I would really like to thank Dr. Goel. Without his support, this article would not have seen the light of the day.
Yeah, thank you, Latika. And it's only because of social media and because of the pandemic that we entered into a relationship and we were able to develop this article together. And that's the impact of social media in these times and in scientific literature. Thank you.
As the COVID continues, maybe we'll see the final chapter very soon, but you never know, of course. Congratulations once again. Lastly, the award for Australia goes to Poetic Praise for an award well won, which perhaps also justifiably is the last award for this session, provided by Ian Wicks, who is joint head of clinical translation at Walter and Eliza Hall Institute and professor director of rheumatology at Royal Melbourne Hospital in Melbourne, Australia. Congratulations, Ian.
My sincere thanks to the judges and the organisers of the symposium for the opportunity to read this poem. But I'd like to start by saying a few words in recognition of the traditional owners of the land on which I'm speaking to you here at the Walter and Eliza Hall Institute in Melbourne, Australia, the Wurundjeri people of the Kulin Nation, who have been custodians of this land for over 50,000 years. In a spirit of reconciliation, I pay my respects to their elders, past and present. This poem was written in honour of Professor Jacques Miller, who is a living legend here at WEHI. Jacques discovered the function of the human thymus, a landmark moment in the history of modern immunology. In 2019, he received the Albert Lasker Basic Medical Research Award for this and related work identifying the T and B cells in our immune system, an award he shared with Professor Max Cooper at Emory University. As with all poems, there are challenges of entertaining and surprising the reader, and with medical poems we have the added challenge of not inadvertently giving a lecture. Because Jacques is a colleague here at WEHI and I know a little about his story, I chose to present the story of the thymus in a very personal way, personalising it if you like, in the hope that it might remind a general readership that there are always real people behind the medical breakthroughs that increasingly, it seems, we risk taking for granted. The poem is called Thymus. Thymus. It was the last known organ with no known function. The thymus, long considered vestigial, just a fleshy mass in the thorax that withers with age like something we outgrow. From this distance, we would agree it was a problem worth solving. And some might say it was not so surprising that a Franco-Australian medico, who had seen TB up close in his family, taking flight from war, suspected he was just not suited for a life of orthodoxy in medicine's old school. Or that one day young Jacques Miller might see a travelling scholarship advertised in the MJA. And with that he departed from his sandstone alma mater, taking little more than curiosity and a bursary from the Antipodes, to find himself at an outpost of the Chester Beatty, in stables for the horses converted into a makeshift laboratory, in the English countryside near Pollard's Wood. He says he had no intention of solving a major problem, but was intrigued by Gross's virus, and so, with surgical flair, he set to work, excising and transplanting the thymi from newborn mice, and engrafting a tapestry of matched and mismatched skin. It was an experimental masterpiece. And while 60s London swung, Miller showed the ancient thymic lobes are in fact essential, the birthplace of T cells, thymus derived and responsible for no less than the defence of self, seeding every infant with a unique immunological repertoire within days and for life.
Ian, thank you very much indeed. I think we can go over to you now, live from Melbourne.
Yes, well, welcome, 3 a.m. here, and like everyone else, I'm delighted to be able to join in and honoured by the award. Really have enjoyed the discussion. It's been fantastic to hear from so many people around the world. This poem was, well, I guess a few words, medical poetry, a difficult art. It seems one way to me of communicating our message more widely. I think the great challenge we all have is of preaching to the converted. We all kind of agree on things, but we need to convince the people that we're not talking to regularly that we, that may see the world quite differently. So for me, The challenge of writing medical poetry is to try and make medical and biological themes accessible to the non-expert, and part of that with this poem was to try to explain the personal journey of a living legend in the history of modern immunology, is still with us, namely Jacques Miller, and celebrate his prize. The poem was published in an Australian online journal called Cosmos, and I think it's appropriate. Its subtitle is The Science of Everything. It aims to make the world of science accessible to everyone, and as we've heard so eloquently this morning, that is a huge challenge, and but more important than ever. So thank you. I'm honoured, and I've really enjoyed the online discussion. So thank you.
Ian, thank you very much indeed. Before we close the session, I thank all our entrants, my colleagues at the FPM and at our two journals, the Postgraduate Medical Journal and Health Policy and Technology, and you, our audience from around the world. You're very welcome to join us at future webinars and conferences. You can find dates and details on our website, thefpm.org.uk. Finally, the submission deadline for the next in these annual International Awards for Medical Writing and Social Media will be the 31st of May 2021. Do please spread the word.